we know we have a target, and systemic stuff where you may want to get into the bone marrow, or you may have to get up into the brain, or other places where you can't just point and shoot, if you will. We've talked about anti-angiogenesis, and there's no question that pretreatment of this will improve oxygenation of tumors. It'll also specifically allow other drugs to get in better. But from a radiation therapy, certainly there's a role for this, and because it's not anti-VEGF, for what we're talking about, versus directly on the endothelial cells, some of the side effects we might find with anti-VEGF, like for instance in the kidney and hypertension or GI bleeding, may not be don't seem to be an issue. So this is maybe a safer and hopefully cheaper way of getting at some of those benefits. And maybe we can figure out who to use it on and who not to use on by looking first and individualizing our decision making, and maybe even following up whether we actually got to where we want, or maybe we should do more cycles. And in fact, I didn't point out, but if you look at where the angiogenesis goes, as it, for instance, migrates towards the path at which cytokines are being emitted from the tumor, maybe, especially if you're driving a gamma knife, you guys could cut around and then focus, rather than making a big circle, focus the gamma knife along that path, because that's the same path that the metastatic cells are following. Everything goes with the flow. Second thing is we can get at the possibility of using HIFU with these different agents. And I think HIFU may actually have a great response, maybe even in cleanup afterwards of XRT. So HIFU, this stuff, maybe the thermo-label doxorubicins all go together. It's up to you guys to start thinking, how can we put all these things together? Finally, I just wanted to point out that there's a multiplicity of new